Welcome to the Arctic Gynecenter webinar series.
Good morning, everybody. Welcome to another beautiful day in the month of April. Today, 25th April. I welcome you all to our antenatal health talk series. Today, we'll be discussing a very important topic, and this has to do with our bundle of joy, the babies themselves, which is very important. Care of the newborn. And to do justice to that topic, we have the pleasure of our visiting consultant pediatrician, Dr. Adesola Adelaja. She's in the room with us this morning, and she will be telling us what we need to do, how to care for the newborn once they come into the world. So, join me in welcoming Dr. Adelaja to the floor. Dr. Adelaja, you have the floor. Thank you, ma.
Yeah,
Thank you for joining us this morning. All right.
thank you very much, Dr. Atoki. Good morning, everyone. I want to warmly welcome you to today's antenatal series. I'm Dr. Adelaja, consultant pediatrician. So I'm sure talking to expectant mothers, pregnant mothers, nursing mothers, even some nursing fathers may be in the house. So I want to welcome you once again. So today we're going to be discussing about care of the newborn, care of our little humans. There's such a huge responsibility to us, and it's important that we take the right steps and ensure that we do all we need to do rightly. So at the end of today's discussion, we should be able to know both the immediate and routine care that should be given to these babies. We're going to discuss about warmth, care of their skin, care of the umbilical cord and the eyes. Also, exclusive breastfeeding, very important, immunization, how to identify danger signs, and the harmful cultural practices that we do engage in our communities. So I'm sure you all agree with me that caring for newborns is very important, especially in the first few days, few weeks, few months. It's very important that we know what to do and we know when to do these things. So majority of newborns, majority of babies, when they are born, they cry immediately and everybody is happy. You don't need to do too much. Just nurse with the mother and carry on with the essential care. Just a very few will need extra, extra or advanced care. And so to ensure that these babies do not fall ill, to maximize their potential for growth and development, it's important that we know what to do. And like I mentioned earlier, warmth, breastfeeding, preventing infection in these babies are the basics that we need to be able to do when they are born. And it's also important for us to know that most of the things that we need to do for these babies, they're not even expensive. They are low-cost, evidence-based intervention that would improve the outcomes, the survival rate of our newborns. And so I'm going to be starting with warmth. When a baby is born, whether in the delivery room, in the labor ward, the baby is supposed to be delivered onto the chest of the mother and placed skin to skin so that that baby's body temperature is maintained. And even that process encourages the mother to produce breast milk, encourages mother to lactate, also encourages breastfeeding. So it's important that the baby is kept warm And after cleaning the baby is wrapped, dress up for the baby, wear the cap, mittens, socks to make sure that the baby is kept warm. It is very important because when temperature is too low, it can make the baby ill. So we need to know how to dress for our baby. Now, another thing you will notice about babies is that when they are just born, there's this whitish substance all over their body. We refer to it as vernix caseosa. That is how they are born. That is the way God has made it. And this substance is protective for them. So traditionally, what people do is they want to remove this coating on the body because they believe that it's a source of body odor. But this myth is completely wrong. So I need you all to know that this whitish substance actually protects your baby from microorganisms from getting to your baby. So it's a protective layer on top of your baby's skin. And for the first 24 hours, you don't even have to bathe your baby. All you need to do is clean the blood, mucus, which your healthcare provider will do. The blood, the mucus, any other thing from the baby, dress the baby up, keep the baby warm, and your baby is safe with you. And by the time you start bathing your baby too, ensure that you use warm water, not hot water. Warm water means that you can conveniently dip your hand into the water, without it hurting you, and is just warm enough for your baby. And the bathing process shouldn't be too long because if it is so long, your baby gets cold and that is dangerous for your baby. So the bathing process should be done gently and quickly, and your baby should be dressed up and kept warm. So another area that mothers are always worried about is how to care for their baby's umbilical cord. So when your baby comes out, when your baby is delivered, your healthcare, your doctor or your nurse would clamp the cord, and this signifies the separation of the mother from the baby. So the cord is clamped and cut, and this cord should always be kept dry and out of the diaper area. So you don't want the cord to be in contact with urine or baby's poop at any time because that can get the cord infected. So if you look at the picture on top of the slide, you see how this baby's umbilical cord is neatly clamped and kept out of the diaper area. So that's how your baby's cord should be at all times. And then you should apply your chlorhexidine gel daily. Please don't use more than once a day, daily. So the recommendation now is not even methylated spirit, but chlorhexidine gel, because chlorhexidine gel will keep away microorganisms that can infect your baby's umbilical cord. So you apply that once a day and leave out of the diaper area. So normally within 1 to 2 weeks, the umbilical cord will dry or shrink and fall off. But sometimes it may be longer. Sometimes it may take 2 weeks. Sometimes it may even take up to 3 weeks. But if you notice that your baby's cord has not fallen, it's taking longer than usual, please take your baby to the hospital so that your baby can be examined and we can check to see if there's anything to worry about. And never pull the stump. It is very dangerous because if you pull the stump, baby can start bleeding, can bleed a lot from that stump, and that is that we don't want that for the baby. So the things to look out for is there any change in color, any change in color, any discharge? If you notice any discharge has a bad odor or looks like blood, then you must see your doctor immediately. So usually the cord would change from yellow to brown, then black. This is absolutely normal. And just right after that, it falls off. And once it dries, then you don't need to apply anything anymore. Just keep it dry at all times. So that's about the umbilical cord. So what about your baby's eyes? At delivery, your healthcare worker will examine your baby's eyes after delivery. Now, the danger signs to check for there are redness. Are your baby's eyes red? Or is there any discharge from your baby's eyes? If you notice any of this, you must alert your nurse or your doctor immediately so that treatment can be commenced immediately. And some people apply eye pencil, kajal to the baby's eyes. Now, this is totally uncalled for. You don't need to apply kajal or eye pencil to your baby's eyes because these eyes are very fragile, and you don't want anything that would cause you transmitting infection into your baby's eyes or exposing your babies to toxic compounds. So one of the other things that we must discuss today is breastfeeding. Breastfeeding is very, very important. You cannot overemphasize the importance of breastfeeding for our babies. So after a baby is born, within 30 minutes to 1 hour, it is important that a baby is put to breast. Even having a cesarean section is not an excuse not to put your baby to breast. So your healthcare provider will help you to ensure that this is done. So ensure that your baby is put to breast within 30 minutes of birth. Very important. And you see, if you look at the picture I have here, you see that the first bottle contains breast milk. So we call this breast milk liquid gold because it's just telling you how important this is to the survival of our babies and to their growth and development. So the initial breast milk that you produce in the first couple of days, which we call colostrum, is very, very important for your baby. It's usually thick and deep yellow and contains a lot of antibodies that would help your baby, that will prevent infection in your baby. It's the way God has made it because this baby is is in a new environment, exposed to all sorts of things. So that initial milk that comes out of the breast in the first few days, colostrum, is very, very important, and it would prevent um, some infections in your baby. So it's important that your baby doesn't miss out on this colostrum. And so if you delay putting your baby to breast, your baby would not get the benefits of this colostrum. So put your baby to breast as soon as possible within 30 minutes to 1 hour. And also proper latch is very important. So your baby should be put to breast in such a way that the whole of the nipple is in the mouth, not just the areola. That's not just that rough top on the nipple. The whole of the nipple plus the upper part of the areola must go into your baby's mouth. That way, the mother doesn't experience pain while breastfeeding. And once there's no pain, she's comfortable to breastfeed and breastfeed for long. So it's important that you do that. Also, the baby's head should be at your elbow and your hand should support your baby's bum while your baby's tummy is on top of your own tummy. So if you position that way, you see that your baby's cheek, shoulder, and hip is in a straight line. So that way your baby is facing you. You're putting your baby, against your body, well attached to your body, and your baby is comfortable to suck properly. So that proper latch and positioning is very, very important. And your healthcare provider would support you in achieving this so that breastfeeding would not be difficult for you. Now, what does it mean to feed a baby on demand? Feeding a baby on demand is very important, and this just means that apart from you feeding your baby every 2 to 3 hours, when your baby cries or you see um, some things to suggest that your baby is hungry, you must feed your baby immediately. You must do that immediately. And exclusive breastfeeding is what we advise. Exclusive breastfeeding is very important, and it just means that you're giving your baby only breast milk, except maybe the doctor has prescribed some form of drugs or there is any contraindication to breastfeeding. But apart from that, if you are practicing exclusive breastfeeding, you're giving your baby only breast milk, no water, no herbal preparation, no formula. So sometimes mothers come to us because they're worried, oh, why can't I give my baby water? How am I so sure my baby is getting all the water it needs? Now, do not worry about that because your breast milk contains more than the water in your breast milk is much more than 80%. So 80% of the content of your breast milk is actually water, and you can be rest assured that your baby is getting enough water if you are practicing exclusive breastfeeding. So yes, your baby should be fed on demand, and always monitor for to see if baby is hungry, baby crying, putting the hands in the mouth, making suckling noises. Sometimes baby would turn the head sideways, looking for the breast. You know that baby wants to feed, and you should go ahead and feed them without delay. So another concerns that we've noticed in mothers is um, they are worried. A mother wants to know, how am I so sure that my baby is getting enough to eat? How am I so sure that this breast milk is enough, is filling my baby up? So most of the time, when you put your baby to breast, your baby empties one breast and then the other breast and then sleeps off. I mean, that's enough for you to know that your baby is satisfied. Another way to know is that if your baby is having several wet diapers per day, and you are also noticing pools in baby's diaper in a day, then you know that your baby is getting enough to eat. Your baby sleeps well, especially during the day, because most babies at night tend to be alert. So, that's how they are. They keep you up at night and all. But during the day, they sleep well. And also when you go for your checkups, your healthcare provider will check your baby's weight every time you come for your appointment. And so if your baby is gaining weight, adequate weight regularly, then you know that your baby is, feeding enough, is getting enough. It's getting enough breast milk, and you don't need to add any other feeds or formula, especially in the first 6 months. Notice that, and please take note that the exclusive breastfeeding I talked about is for 6 months, not 3 months, not 4 months. For the first 6 months of life, your baby should be um, breastfed. Okay, so now let's talk about other general care, the sleeping position. So the best sleeping position for your baby, a term baby, is to lie on the back. Place your baby to lie on the back in the cot. That is the ideal position to put your baby in. And always wash your hands. Always wash your hands before you attend to your baby, before you know, dress your baby or put your baby to breast and all that. Your surroundings should always be clean. And sometimes you can also use your hand sanitizer, you know, when you can't immediately get access to running water and soap. You can use your hand sanitizer also. And to prevent diaper rash, that's another common um, complaints of mothers when you have rash in the diaper area. And most of the time, in fact, 95% of the time is usually because we keep our baby's diaper wet for so long without changing it. So it's important that when your baby's diaper is wet, even if that pee or poo was recently passed, you must change it immediately. Yes, you may have to use several diapers per day, but that is the solution to prevent diaper rash. Because if you don't do that and you keep applying different products on the skin, the rash would keep appearing because what is causing it, the what you're exposing your baby to is still there. That's urine, the poo is still there. So it's important to always change your baby's diaper. There's nothing like I change the diaper 3 times a day or 4 times a day. No, it must be changed immediately. It's wet or soiled. Very, very important. So sometimes you may have somebody sick in the house or within your environment. Please try as much as possible to keep your baby away from anybody that is ill, because we all know that their immunity is still growing. They're not yet strong enough to fight back this infection. So it's better they are kept away from any sick or infected individual. So another important thing that I like to mention is the way you handle your baby. You see that some people like to throw their baby up, while playing with baby, um, throw them up, vigorous with the way they handle the baby. So please be careful. You don't need to throw your baby up vigorously. I mean, these are newborn babies, so handle them with care. If you need to wake them up to feed, because it's actually important that you wake them up to feed. They like to sleep a lot, but when it's time to feed, you rub their feet, tap their feet, and to make them awake and feed them, you know. And please don't stop talking to your baby. When your baby was in your womb, at from a particular age, a baby can actually hear your voice and gets used to your voice. And then when the baby is born too, so continues to hear your voice, and it helps in their brain development too. So speak to your baby, interact with your baby, bond with your baby is very, very important for the growth of your baby. So the next thing we're going to be talking about is immunization. Immunization is very important, and it is important that you know your own program of immunization in your own country. And it's also important that you know the possible side effects that you can get. So there are some mild side effects that are attributed to some immunization, and there are not enough reasons not to get this immunization, because the benefits of getting them outweighs the risk when you don't receive the immunization for your baby. And most of these mild side effects would disappear with time. So it's important that you know that you must visit your healthcare provider at birth. There is a certain vaccine that will be given 6 weeks, 10 weeks, 14 weeks, um, 5 to 6 months, 7 months, 9 months, 15 months, then 9 months, then 9 years. So it's important that you know all this. And it's always good to know what your baby is getting. To the name of the vaccine, yes, as a mother or father, you should know the name of the vaccine your baby is getting. You should know which part of the body your baby is getting it, and you should know what infection that this vaccine is helping to prevent. So always ask questions, and I'm sure that your doctor or your nurse will be happy to answer your questions. So some of the side effects, like let me just give one or two of some of these mild side effects that you could get. For instance, there's a particular vaccine given at 6 weeks. The diphtheria prevents diphtheria pertussis and tetanus, usually given on the thigh, is intramuscular, and after receiving that, your baby may develop fever, may feel that the baby is warm, which usually would resolve with use of paracetamol. And sometimes that site may be swollen, but your healthcare provider will teach you what to do, and these symptoms usually will resolve. And they even show you that the vaccine is active and your baby is getting the immunization is active, and we are achieving your aim with the immunization. So, but if you notice anything at all after immunization, just make sure that you go back to your healthcare provider to make a complaint, and I'm sure your baby will be assessed and the right thing will be done. So let's go on to danger signs. So as a mother, or a caregiver, there are important signs that you must watch out for. These signs, when you notice them, you must not delay at all. You must present to the hospital immediately. So, because if you notice the signs and nothing is done about it, there can be progression of whatever it is that is wrong, and this can result in morbidity or mortality, and we don't want that. So when you recognize danger signs on time, you prevent serious illness, you prioritize care, and you improve outcomes for this baby. Now, number one, if you notice that your baby is refusing to feed, you have tried to breastfeed, your baby is not sucking, that's a very, very important danger sign. You must present to the hospital immediately. Also, if you notice excessive crying, your baby is irritable. Now, I'm not talking about your baby cries, you breastfeed, your baby stops, or consolable cry. No. So if your baby is crying, you breastfeed, the baby stops, or sometimes you may need to sing, dance, do all that, and your baby stops, or change the diaper. No, that is completely normal for a baby. But if your baby is crying, you've done all that you need to do, you've changed the diaper, you've fed, in fact, the baby is not even, taking the feed from you, then your baby is irritable, then you must see a doctor immediately. Also, convulsions. Convulsions are abnormal movements, jerky or stretchy movements that is different from what you are used to. You must also present to the hospital immediately. For babies, the way they breathe, if you look at your baby closely, you see that the way they breathe is a little faster than the way adults breathe, which is normal. But when you notice anything faster than the normal breathing pattern you're used to, or you notice this chest wall injuries, your baby's chest seems like it goes in, out, something that wasn't there before, any new pattern you're not used to, please present to the hospital immediately. It's also important that you know the normal body temperature. So the normal body temperature is between 36.5 to 37.5.
I don't know why they don't want to pay us salary. What's the
Every mother should have a thermometer. So you can get, there is the mercury thermometer that is usually used in the hospital. You also have the digital one. So you can get the digital one because it's easier for you to use. You just read it. I mean, the reading just appears after 1 to 3 minutes. You leave it in the armpits for 1 to 3 minutes, pull it out, and then some of these digital thermometer will even beep. So when it's time for you to pull it out, it beeps, you pull it out and read it. And if you have any figure below 36.5, then you know that what that means is that your baby's temperature is low, your baby is cold, and this is very, very dangerous. So what you should do in that, when you have something like that, is you must wrap your baby, dress for your baby very well. Maybe it wasn't wearing a cap, put on the cap, socks, wrap your baby well, and you should go to the hospital so that your baby can be checked to be sure that it's not just the environmental temperature that is a problem. If there is any other thing that your healthcare provider needs to look into, then that will be done. Also, if you've noticed any reduction in movement, your baby that used to be very active suddenly is just, not moving as much as it used to, looks weak, lethargic, that is also a danger sign. You must see your doctor. Now, significant jaundice. So, when you give birth to your baby, before you leave the hospital, your baby will be monitored, checked for jaundice. But sometimes it doesn't become significant until maybe you may notice that your baby is looking yellow, the eyes or the skin is looking yellow at home. So you must come back immediately so that this jaundice level will be checked, and if it needs to be treated, it will be treated. If you look at this picture I have here, you see this baby, you see that the skin is looking very yellow. Now, this baby is looking yellow from the head up to the legs. This is already showing that this baby has severe jaundice, and we don't want to get to the point where it's severe, because jaundice in itself is dangerous. When you have high levels of jaundice, it affects the baby's brain, and so we don't want that. Once the baby's brain is affected, it affects the way they grow, their growth, their development, their and so to avoid this, you must be able to pick jaundice early, present to the hospital early so that it will be treated immediately. Also, for the weight, your baby's weight, when you go for your checkups, your doctor would check your baby's weight, make sure your baby is gaining weight adequately, and there is no exaggeration in the drop in the in baby's weight in the first week of life. So that's very important. And the method and the way you feed will be discussed. If you have any concerns, you'll be able to discuss with your nurse or your doctor. So other things that obviously is a danger sign is if your baby is vomiting, if you notice that your baby is passing watery stool, you know that yes, it's time to see the doctor, and it must be done without any delay. Okay, so the next slide I have here, we're going to be discussing about harmful cultural practices. So these cultural practices are, most of them, I'm sure we are familiar with. Some of us might have even been brought up with some of these practices. But the truth is that research goes on day by day. We are now more aware of we're getting more aware of our surroundings, what we should be doing and what we should not be doing. So a lot of these things, we're trying to throw them away and do things that will not put our baby's health at risk. So, first of all, you don't want your baby's umbilical cord to be cut with an unsterile instrument or with a dirty scissors or with blade. Blade is not sterile. So your doctor will use a sterile blade, not the blades that we buy outside in the mats and all. So a sterile instrument must be used to cut your baby's umbilical cord. Then the umbilical cord, after cleaning, apart from your chlorhexidine gel, please don't apply any other thing. So some people will apply toothpaste and some other, traditional preparations on the umbilical cord. This is unnecessary and can predispose your baby to infection. Then use of herbal preparation. So what your baby should be getting, you should be getting into your baby's tummy is breast milk, not any form of herbal preparation. We've seen quite a number of babies that end up in the emergency room because of one herbal preparation or another. Most of these preparations are made with alcohol. They're made with some leaves that, there's really no dose. It's to just mix different herbs together and give these little babies. And take note that their kidneys are not well developed, their liver is not well developed, so they can't even process most of these herbal mixtures that we give them. So it's very important that we stay away from these herbal mixtures. Okay, so for the treatment of just jaundice, the right thing to do when you notice yellow coloration of your baby's eye or skin is to take your baby to the hospital, because you never know what level it is. Early morning sun would not clear most of those jaundice that needs treatment in an hospital. So it's better to go to the hospital, let them check the level of the jaundice. If it's significant, if the level is significant, then treatment can be started immediately. Because the truth is that most of the time, most babies would have jaundice, but the level is what determines if it's treated or not. So if it's not a significant level, it drops by itself without any intervention. But how do you know that if you have not tested to check? So please always take your baby to the hospital when you notice jaundice. So I'm going to talk about soft spots now. What do we refer to as soft spots? On your baby, on the top of your baby's head, there's a space there that is usually diamond in shape. Is there for a reason. That is the way God has made it. It's not that something is wrong with your baby. No. It's softer than the other parts because there's no bone in that area, but there's structures there. There's a covering there. So it's not like your baby's brain is exposed. No. No, no, no. Your baby's brain is not exposed, and nothing is going to happen to your baby's brain because of that space. So the way it is there, that space is there for a reason. It gives room for your baby's brain to grow. And sometimes when you touch it, you feel it pulsating. It's normal for it to pulsate like that. But traditionally, we believe that, oh, that space shouldn't be there. So people they apply different herbal mixtures to cover it, believing that when they cover it, then the baby's brain is not exposed to the outside. So, but you don't need to apply anything. Just let it be, leave it alone, and that gives room for your baby's brain to grow. So some people force feed their baby. They feel that baby is not taking enough. I want my baby to eat well. I want my baby to take more, and then they force feed the baby. So the risk in doing that is that your baby, the food can go the wrong way. So if you look at the structures in the neck, you have the breathing tube is in front, the feeding tube is at the back. So your baby struggling to swallow at the same time breathe, during that period, the food can go into the pipe that is meant for breathing instead of into the pipe that connects the mouth to the stomach. And what happens thereafter? Then your baby that was healthy before becomes ill, start breathing fast, and then you have to present to the hospital. Now, you may say that, oh, I was force-fed as a baby. I've seen a lot of babies being force-fed and nothing happened. But when do you know? When, you never know when something will go wrong. You never know the baby that would aspirate, that's take the food into the wrong pipe. So it's just better to avoid force feeding your baby. Some of these babies, it's not that they will not eat, but they take this food, they feed slowly. So you just have to be patient with them. And if you notice that this is going on for, you've noticed that your baby is not feeling well, then it's time to actually go to the hospital and complain so that other things will be checked and we'll be sure that, oh, there's nothing we need to worry about. Yeah, so another complaint that mothers usually have when they bring their baby in, very, very common complaint is this. They notice that their baby wriggles a lot, seems to be in pain. The tummy, the baby is always, looking uncomfortable and all, what we refer to as abdominal colic. Now, it's not really abdominal pain, but abdominal discomfort. And some babies will have it, and they usually experience this for several hours a day, most of the time in the evening. So mothers notice this and they are worried. They are so apprehensive. My baby is not feeling comfortable. What can I do? So they usually will come to clinic to see us. But today I want you to know that this abdominal colic, yes, it's nobody really knows the major cause of it. But what we know is that the baby's gut is not yet fully matured and they can have this abdominal discomfort. And the truth of it is that it goes by its own. Usually can take up to 3 to 4 months, but after that, the baby outgrows it. It disappears by its own. You don't even need to use anything. So people would recommend all sorts. Some people will tell you use grape water, use coconut oil, use nospamin, Infacol. The list is endless. So you have to be careful too of recommendations from people. So sometimes you use some of these things, and just at that time, it's the discomfort, it would look like it disappeared. But if you have not used anything, it would disappear anyway. So, but our worry is that some of these medications that are prescribed may be harmful to these babies. So we prefer to stay off these medications. And what you can do when your baby is having this discomfort is just to make sure that your baby is comfortable. Check the diaper, is it wet? Change the diaper, feed your baby. Sometimes you need to carry pets, dance, sing, move from one end of the room to the other. It's a lot of work, but it actually works. Now, when to worry is when you notice that your baby is not feeding, then that's not colic anymore. Or the abdomen is distended, that's not colic. Or your baby has a fever, that's not colic. You must present to the hospital immediately. Yeah, so from my experience, skin rashes most of the time in babies. So you see, there's this particular skin rash that you notice just immediately your baby is born. So show it to your doctor because there's a particular one that is harmless. It will clear on its own, no problem. But by the time you are discharged, you go home and you notice some type of skin rash, you should also show it to your doctor. But most of the time, it's because of the kind of products we use for these babies. So you need to know that their skin is so fragile, so soft. They're so vulnerable. They don't need anything harsh. They don't need what's it called now? Medicated soap. No, they don't need Tetmosol. You don't need all these harsh products on their skin. All you need to do is wipe your baby, or when you bathe your baby, use a mild soap, mild toilet soap. The cream too should be something very mild. Doesn't have to be a strong product. So because the more you use all these strong preparations on them, they react to most of these products. So if you can do that, then you would see that your baby's skin will just glow naturally without you using anything. Let us also avoid the use of glucose water. So in place of glucose water, what you should be giving your baby is breast milk. So you need to know that your baby's stomach is so small at that age. A newborn stomach is very small. So when you give your baby glucose water, the stomach is already occupied with glucose water, no space for the breast milk that would really nourish your baby. And glucose water is not going to help your baby in any way. So glucose water, we don't use that. We don't want our babies getting glucose water. And lastly, I also want to mention, quickly talk about the traditional way of bathing newborn babies. I'm sure we are all familiar. We've seen videos of the way traditionally, when your mother or your mother-in-law comes in, and there's this way they bathe your baby. A lot of us believe in it because we believe that, oh, after that bathing of a baby with sponge, some special soap, and those vigorous exercises that they just slip off and all that. But the truth about it is that we have to be careful in the way we handle these babies. They are small, they are fragile, and you don't want to do anything to harm them. You know that you will not do that intentionally anyway, because it's your baby. But we just have to be careful. All those exercises are actually not, they are not advised, and then we have to be careful. We don't want to break a bone or cause dislocation or do anything that would harm the baby, such that you have to now start presenting it to the hospital. We've seen cases, so that's why we need to talk about this. We've seen cases of some injury as a result of that vigorous, exercises that we expose. I mean, some of us I also had that kind of process done. So I'm sure people can relate to what I'm saying. So please, let's be careful in the way we handle our babies. So in conclusion, I like to say that all that we've discussed today is very important, and if we can follow these guidelines, if we can do all these things, then you would end up giving your baby a happy and healthy start in life. So it's very important that we give our baby that, healthy start in life. And it's also very, very important to know that apart from caring for a baby, the mother needs to also care for herself, because without her, if she is not well, she won't be able to do our best for the baby. So sometimes, it can be overwhelming, but you need to know that you need support. So please get all the support that is available. And what I encourage mothers to do is, yes, your baby, you're nursing a baby, delegate other things. I mean, you don't have to be the one nursing the baby and at the same time cooking, cleaning and all that. So if there's somebody that can help you with other aspects of your own chores at that period, then it will really go a long way, So this can be overwhelming at first, but with the right knowledge and support applied at the right time, then you will do very well. And always trust your instincts. If you notice something is off about your baby, don't brush it aside. Always get a second opinion when you notice anything. Don't ever hesitate to seek help when you are concerned about your baby. Thank you very much. It's the end of today's discussion.